Now let's take a moment to go into the studio and see what it means to move the hinge from your low back down into your hip joint. Many people with back pain have inadvertently developed a hinge in their lower back. That is, when they try to bend forward and pick things up off of the floor or bend forward for any reason, they tend to lose this protective curve here and round their backs as they bend forward. The problem is the research has told us that if a person does this frequently or under a load, it may injure the discs in the low back. For that reason, we want to try more spine-preserving, helpful positions to get things off of the floor or to bend forwards. In this case, we want to try to develop a hinge instead in a joint more suitable for it. That's the hip joint, which is a big ball and socket joint and well made to be able to handle those forward bends. So one way to train it is with this exercise called a hip hinge. Use a stick, you can use a broom or anything you've got around the house, and you want to grab it as such so that your bottom hand is grasping the bottom of the stick and facing out away from your body, and your top hand is facing forwards with the back of your top hand against the back of your top hand against the back of your head, and your bottom hand right against this bone here at the base of your spine called your sacrum. There's a third point of contact right in the middle of those two, right in the middle part of your back that you also want to keep in contact with. And essentially what we want to do is to really focus on keeping those three contact points right against our hands and our back as we hinge forward from the hip joints. It might help to direct your eyes up as if you're looking upwards to help remind you to not immediately tuck and go forward. Now go as far as you can without pain, and make sure that you're focusing your movement here in the hip joint, not here in your lumbar spine. So let me demonstrate poor form here. This is poor form. Now you see my hand has left my back down here, and you see that my back has rounded here. We want to correct that by keeping the hand in contact and sticking your tush back just a bit as you hinge forward instead from down here in the hip joint. You can practice these several times during the day to try to regroove that motor pattern to allow you to bend forwards or to pick things up off of the floor without hurting your back.